Welcome back. People with dementia like Alzheimer's may forget how or why they need to protect themselves from COVID-19.
KITV4's Diane talks with a geriatric doctor about the special needs for people with dementia and their caregivers in this week's Aging Well.
I'm talking to Dr. Pokii Balaz. She's a geriatric physician as well as a board member for the Alzheimer's Association Aloha chapter here in Hawaii, and she has some special tips on how to protect people with dementia from coronavirus.
Having Alzheimer's or another related dementia does not put anybody at increased risk for COVID-19. It is really again, those with underlying medical conditions. But those with this cognitive disorder may not be able to process information, so we really want to make sure that when they're watching TV or they're hearing this information, that we pay attention to them, that they're not getting overstimulated.
That also applies to caregivers.
Take some time to find maybe a spot in your house that you can meditate or just take 15 minutes to decompress.
She also advises caregivers to create a backup plan in case they get sick.
Having a backup plan, writing down their medications, their diagnosis, who their healthcare provider is, writing down if they need oxygen, wound care, dialysis.
And in this time of social distancing, how are the caregivers supposed to connect with their loved ones if they can't touch them?
Smile is really, really a wonderful thing to do. You don't have to be close, you can do it, and people with dementia usually respond to that very nicely.
And that, again, is Dr. Pokii Balaz. She's a geriatric physician as well as a board member for the Alzheimer's Association Aloha chapter. And if you want to hear more advice from her as to how to deal with dementia patients, you can check the Alzheimer's Association's website to see when it is going to be hosting its next webinar and get some direct advice from her.
All right, thanks, Diane.